Welcome to the Mental Insights Podcast, a conversation aimed at understanding all sides of mental health, addiction recovery, and homelessness. Each interview will include one's personal experiences and insights, or an expert's advice and knowledge within one of these fields. The goal is to promote awareness, guidance, and support for anyone who is affected by these challenges. Thank you all for listening. Welcome to the Mental Insights Podcast. We are back for part 2 of episode number 7 within season 2 of the Mental Insights Podcast. We are here with Joseph Okoye, and we have spoken within the first part of the episode about depression. And within this episode, we're going to be speaking about antidepressants, and we'll be getting numerous perspectives from Joseph since he has experience as a psychotherapist and as a pharmacist. So it'll be great to touch into what are depressants and how they're being used today to treat people's mental health challenges effectively. Within the world of antidepressants, within what people are facing today, the Mental Health Foundation stated that 59.4% of those suffering from depression have received treatment. So if you look at that, there's 40% of people that aren't receiving treatment at a level today, which is pretty substantial. And this is something that clearly a severe amount of people are facing today. Even if you look at the World Health Organization, as you were stating before, I believe it's somewhere near 800,000 people are committing suicide a year. So we've got staggering numbers in people that are taking that step to end their lives. We have people that still aren't receiving treatment, that are still alive. So there's many different aspects of, where we're losing sight of trying to bring people in order to help them, in order to help alleviate the pain that they're going through. Antidepressants is one of them today that people are using in order to effectively treat what they're going through. Can you speak about antidepressants and what are some types of them that you are prescribing for people in order to effectively treat their depression?
Thank you. Now, one of the reasons why I went into psychotherapy, I was a pharmacist first, then I trained and became a psychotherapist because I saw that both psychotherapy and pharmacy go hand in hand. And I realized that a lot of people come to me with their prescription for different antidepressants. And I could see that in as much as they needed the antidepressants, they also needed counseling and psychotherapy. So I went into psychotherapy. So I'm better grounded at whatever venue they meet me, whether as a pharmacist or as a psychotherapist, I can give them a better balanced information and help. So there are so many antidepressants. And like you rightly said, there's in UK, statistically, it's only like 40% of people who are depressed who have major depression that actually go to their doctors. Only 40%. And out of that 40%, well, about half of them actually have correct diagnosis and eventually have medication prescribed. So antidepressant is very important. There's so many types of antidepressant. We have the ones that we call selective serotonin reuptake inhibitors. Those are very popular and very effective ones, where you have fluoxetine and paroxetine and citalopram. Those are very common and very popular and very effective. So you've got those groups called SSRIs. Then you've got other ones that are what we call atypical antidepressants like venlafaxine and so many other types. And I think as far as antidepressants are concerned, one thing I've always said is they work, they are effective. The most important thing is to always to make sure that if the doctor have prescribed you one and you feel it's not working, or that due to side effects, your compliance or what we call adherence is an issue, please go back to your doctor or your GP because they may not know that you're not taking them. it's always good to go back until you get to the one that suits you most. Because like I said, even among SSRIs, there's so many types. Under SSRI, you still got fluoxetine, you got paroxetine, you got citalopram. So there are quite a good range of antidepressants that people can select from to help them get better in addition to psychotherapy.
I appreciate that, and you're speaking about how there is so much effective measures, and like you're saying, there's a need for them because it allows people to go about their day and not have these debilitating thoughts or feelings, emotions throughout their day. And before we really speak about the positive effects, the true healing measures that they do provide, I want to speak a little bit about, you brought up a little bit of it, of some of the side effects. So for anybody who's coming into this, maybe they have some worries, some angst of maybe some things that are holding them back. What are some side effects that you may see that you just need to be aware of, that people are, maybe if they haven't been taking antidepressants before, or if they're switching from one to the other, what are some kind of side effects, and maybe just what are some warnings, some things that you try to make sure of before you transition someone to another antidepressant?
Right. So in terms of side effects, there are quite a few. I've always, when people come to me to pick up their prescription, they always say to me, is there any side effect? I say, of course there is. Even ordinary painkillers have got side effects. So you've got what we call gastrointestinal side effects, where people get heartburn from certain antidepressants like fluoxetine. In some cases, the doctor or the GP will prescribe you something to help to alleviate the GIT upsets. So you've got that. You've got some people who feel suicidal. It's interesting that depression one of the symptoms of depression is suicidal thoughts. But unfortunately, some of these medications also have suicidal thoughts as a side effect, especially for younger people who are depressed, like under 30s. And the advice is always to keep a stringent monitoring an eye on anybody under 30 at the initial stage of prescribing antidepressant to make sure such side effects are not really ugly hair. So you've got weight gain, you've got sleep disturbances, you've got dry mouth. There are quite a lot of it, but the key thing is, if the side effect is such that is affecting compliance, I always say go back, speak to your GP or your doctor for a review and maybe try an alternative. And also, one of the most important side effects which people seem to miss is, I see, like what we said about depression. One of the symptoms of depression is lack of or loss of interest in pleasurable activities. Now, unfortunately, some antidepressant affects sex drive. So people, both for men and women, is actually quite a good and alarming level of side effects affecting sex drive. Those are the things people should also be aware of. And if it becomes a problem, like I said, go back to your doctor or your GP for a review and maybe to try another antidepressant. If the side effects are minor, I would say stick with it, because sometimes the longer you take the medication, your body will readjust and get used to it, and it won't be so bad. But obviously, if the side effect is so troublesome, then I would say go back to your GP. And also, depending on the type of antidepressant, so if you're prescribed some antidepressant, you should take them at night rather than in the morning. If you're prescribed an antidepressant like what we call metazapine, the best time to take those is at night rather than in the morning. Where fluoxetine, the best time to take it is in the morning. So metazapine are normally targeted for those who have issue with sleeping, maybe the depression is affecting their sleep pattern. So they prescribe the mirtazapine to tackle the depression and also help them to sleep better at night.
Perfect. And, as you were stating this, as you were speaking specifically about some of them that do maybe bring about some of these suicidal thoughts and bring some alarm in terms of some of the side effects, I just wanted to know, in terms of the way that you go about speaking with a client, in terms of, taking that measure of taking that antidepressant, are there any kind of requirements that you make with a client in order to maybe make sure that someone's supporting them or within their care, at certain times of the day, or even if it's not antidepressant that provides some side effects of suicidality, even if it's, some things lacking, are there other measures, are there other things that you require based upon adding to just simply taking the antidepressant? We spoke about some lifestyle changes, but, are there any measures that you really need to take forth with a client to make sure that maybe they're not alone for a whole day, or maybe, especially if they live alone, how do you kind of work throughout and navigate those ways if, that they're going to be in a position that they may be lonely and they may have some increased thought processes of a depressive episode or in that regard?
I suppose it is a question of at the onset when the doctor or the GP would have told them what to expect with some of these antidepressants. And also when they come to the pharmacist to pick up their medication, at the initial onset, it's our job to tell them what to expect and the kind of side effect to expect. And so, like I said earlier on, if it's a young person is prescribed an antidepressant, you have to be wary to make sure that there's a chance of the antidepressant increasing their suicidal thoughts. So usually, I know in UK, most young people under 30 years of age, when they are prescribed antidepressant, the doctor tells them or rings them to, the doctor wants them to ring the GP or the doctor in 2 weeks' time. If they don't get any call, the GP will ring. Also, the families are also encouraged to support the sufferer, either their parents or their spouse or their siblings, to support them, knowing that they needed that support to get through. Especially, the thing is that at the early stage, one of the things about antidepressants I also want to mention is their effectiveness is not instant. So it might take up to 3 weeks, up to even 6 weeks for the effectiveness of the antidepressant to kick in. So those are the kind of not support and understanding and enlightenment that those suffering depression needs to be made aware of. And also they need to be made aware that of places they can ring, that they can always, ring in England or UK, they can ring NHS 111. There are places that they can ring to ask questions, or people can always ring the pharmacy to ask questions about their medication, how they're getting on, if there's questions about side effects or their dosage regime that they want to find out about. The pharmacist I'm always available to answer those questions.
That's great. I'm so glad you brought up the topic of how long it could take to effectively, work within your body, because, within any type of antidepressant, it could take from, X to Y in terms of how long it's going to fully digest in your system and actually take place and actually start. And, this leads to the conversation of, first within somebody, how long is usually the case of some people being on antidepressants? Are the time frames, a few years? Do some people sustain with it for their whole life? And within that, what are some of the effects if someone's taking an antidepressant over a long period of time? Is there some effects that you see if someone's taking it plus 10 years? Again, kind of what's the time frame, and are there side effects if someone does take it for, a longer period of time?
Okay. Now, antidepressants, the good thing is that these medications have gone through rigorous trials and clinical testing.
Mm-hmm.
And one thing I've always said is the longer the antidepressants have been available, the better safety profile they have. So something like fluoxetine, which used to be known as Prozac, it's been around for a very long time, which means that the safety profile is good. In terms of how long to take them, now, if somebody is suffering mild to moderate depression and is put on antidepressants, the minimum most of the time is 6 months. I would say 6 months to a year minimum.
Yeah.
Some people come to me and say, "Oh, I'm feeling better now. Can I stop taking it?" I say, "Well, the truth is that the medication is working. That's why you're feeling better. And there's no need to be in a hurry to stop taking them. The doctor or the GP will tell you 6 to 12 months. Now, whether you take it beyond 6 to 12 months depends on how you're feeling. And also, even when you're ready to stop, again, you need to go back to your doctor and GP so that they will monitor your regime and agree a regime on how to gradually stop it rather than stop so suddenly. So that's something also to bear in mind. Now, for those, there have been instances where people have stopped because they thought they are all right. A few months down the line, they went back into depression and they have to go back on antidepressant. So when people have what we call recurrent depression, they always want to keep them on antidepressant for at least 2 years, if not longer. So for those who are having contact with antidepressant for the first time, 6 to 12 months is what the prescribers mostly do. But if it's a recurrent depression, at least 2 years, if not long. And like I said, a lot of the antidepressants have good safety profile. So far, in terms of side effects, is no more an issue. I wouldn't advise somebody to be in a hurry to stop it until they feel they are really ready, which shouldn't be less than a year for first timers or less than 2 years for recurrent depression. But that also needs to be done in supervision and agreement with the GP.
Earlier, you spoke a little bit about as being a pharmacist, you've seen some people coming in, basically getting some antidepressants, but you've realized that they did need counseling as well. And I think this is such an important topic to speak about is, when someone's prescribed antidepressants to treat their mental health challenge, whether it be depression, what is the need for having therapy as well? So, why does therapy need to be accustomed as well with taking antidepressants? Because you can see some people that take antidepressants and they never heal. They never really are able to work about whatever challenge it is. In my instance specifically, it would be for someone who maybe has experienced, say, like a childhood trauma, and they're taking these antidepressants, but maybe they haven't worked with a therapist to go through their healing of what they may have experienced as a child. Can you speak about kind of the importance of, associating and having therapy combined with antidepressants in order to work through the healing process?
Okay. Now, it's interesting. Earlier on, we were talking about people who need antidepressants and they don't have access for one reason or the other to get it. Mm-hmm. On the other hand, you have some people who actually all they need is counseling and therapy. But because they haven't got access to counseling and therapy, the quick fix is to prescribe antidepressant for them. So for instance, like I said earlier on, if somebody needs mild depression, what they actually need at that point is counseling, psychotherapy, and support. But because sometimes access to therapists due to cost or due to where they live or due to waiting time, they can't access a therapist. So all they end up doing is just go to the doctor to prescribe an antidepressant. That's one point. The other point I want to make is if somebody is going through moderate to severe depression, medications are very important, but medication on its own is not enough. They need a combination of medication and psychotherapy and counseling. Even the guidelines, even the National Institute for Care and Health Excellence in UK will tell you that you need both. You need both counseling and therapy in addition to medication to combat and get a most effective treatment for depression. And so there's no question about the importance of multifaceted approach, because the thing is that when you've gone to the doctor or the GP to prescribe antidepressants, they haven't told you, like you rightly pointed out, they may not be aware of the root cause of the depression. They may not be aware that somebody has been going through bereavement or loss for one reason or the other. They may not be aware that they are suffering from loneliness. They may not be aware, or even if they are aware, they are not in a position to help. So there are a lot of factors, underlying causes of depression, which while the medication is dealing with the immediate feeling better and lifting up the mood, you still have to deal with those root cause problems, because they're not going to go away. And that's where therapy and therapists come in. And this is, again, like I said at the beginning, that's why I am in such a vantage position being a psychotherapist and a pharmacist to see how this work together and how to appreciate how important it is to combine both to get the most effective result.
It's so awesome, Joseph. I appreciate that. And that's why I was so excited to bring you on and see the perspective that you had, because you really are able to see it from two sides. And you can see some people who maybe are a psychotherapist and, look at antidepressants in one way and look the way that the pharmacy industry is. And then you can see it from the flip side of how it is. So it's good to see both sides and have your perspective within this. And within my last question for, our time together, I think it'll really wrap up the work that you've done and kind of the way that you see our society moving forward, and what kind of hopes and measures you see as we move forward in our society. And with that being said, I want to offer you this hypothetical situation in that basically I'm providing you this opportunity to a large grant of money. So say you were to be given $1 billion. I want you to give some of the resources, some of the approaches that you would make. Where would you allocate these resources to assist the people facing depression, any type of mental health challenge, whether it be schizophrenia, whether it be bipolar disorder? What would be your steps in order to help alleviate the crisis that we're seeing within our society today?
Well, that's like I said, it's multifaceted. So for starters, we have to look at social support. Social support is key, because after all said and done, people need social support. Look at how much support they are getting. I think one of the greatest pillars of mental health support is social support in terms of community support. What kind of community support do they have around them? Do they have people that they can pick up their phone and ring? Because people are suffering with different mental health issues. And when they need just a quick question or a quick test, I don't think there's any scenario where you have groups who are there to actually look after a group of, say, in a society, in a community of 10,000 people. There is nobody there who is easily available 24/7 to help them, to listen to them, to answer their questions. So it would be nice to have a unit that have a counselor, a pharmacist, a carer, people who are able to listen to people talk and help them. Then also, obviously, we need to invest in nutrition, diet, and lifestyle of people with mental health. How are they living their life? What kind of help do they need in terms of physical activity, in terms of their diet, in terms of their lifestyle? Then also, obviously, medication. Medication needs to be available. It has to be available when they need it. And also, the money shouldn't be an impediment for them getting the treatment they need. And also enlightenment, continuous education and enlightenment in the society about mental health. I mean, mental health has come a very long way in terms of educating people of the importance of mental health. All right, so both of them need support, both of them need help. And so that's what I would say. Both of them need to be both lifestyle, education, treatment, all this needs to come together so that people with mental health can be supported better.
Perfect, Joseph. I love that answer. And I think those are definitely effective measures that we can take within our society to, to make that next advancement in terms of, healing many of the people that are facing some of these challenges. And, as you stated, a lot of them are within means of us doing. It's just, allocating the right resources to make that next step. So I'm so glad you were able to join me on the Mental Insights podcast and share your insights and share the knowledge that you have, because it's great to see someone who has a multi perspective of what's going on within the industry and some steps that we can to make and what we can do to move forward. So I'd just love to thank you for taking this time with me today. You were at episode number 7 of season 2 of the Mental Insights podcast. And I just want to thank you for being here, Joseph.
Thank you for having me. It's a pleasure.
Perfect. Well, thank you all for listening again. This was season 2, episode number 7 of the Mental Insights podcast with Joseph Okoye. And you can find all of Joseph's work, his counseling company, you can find his website, you can find the work that he does, as well as some of the resources that we spoke about within this episode below in the show notes. So you can get accustomed, you can reach out to Joseph. If you are in the UK, that is a great resource to connect with. So thank you all for listening again, and be sure to tune in to the full episode with Joseph Okoye if you haven't listened to already.
Thank you all for listening to today's episode of the Mental Insights podcast. Make sure to reach out to today's guest or myself if you need any advice, guidance, or support in your life today. Please be sure to like, subscribe, and review to this podcast so we know what you thought of this episode. I look forward to being in touch with you all in the next episode. I hope you all have a wonderful day.